Hi guys, this is a 58-year male patient. He presented to complaining of only bilateral pedal edema. You can see this much of the deep pedal edema he is complaining. Only bilateral pedal edema. We have ruled out all the causes of the pedal edema by clinically. First we find for this pedal edema we found that is maybe a CCF patient. So we thought that there is no signs of CCF. Like what are the signs of CCF? Increased JVP, hepatic tenderness, and there is no any systolic murmurs anything. So this is not a CCF patient. And next we have investigation for the routinely like RFT we have done. Creatinine, urea, everything is normal. There is no causes of renal causes for this pedal edema. One more thing is there is no any specific joint tenderness so that the joint effusion anything. So this is also not there. And next step we have gone for the history of alcoholic. If the patient is an alcoholic, there will be loss of albumin in the blood, and because of the loss of albumin there may be ascites or pedal edema. In this patient he is not having any ascites, only pedal edema is there. So this is also ruled out. And next patient is he is not a generalized anasarca. If it is a generalized anasarca anything, you would have suspect for any thyroid disorders. It is a hypo or hyper something. So next thing we have gone is locally signs of one important thing is cellulitis and the DVT signs. So in this patient you can clearly see that this leg is not having any features of cellulitis. What are the features of cellulitis? That is signs of inflammation, calor, duber, rubber, everything. Like tenderness is not there, and there is no any warmth, tenderness, and discoloration. This all is not there. That's why this is not a inflammatory causes. There is not a signs of cellulitis, and there is no any DVT signs. If it is a DVT, there will be a human sign will be positive. If you can see if you press here, there is no any tenderness. Here also calf muscle tenderness were not there. There is no any tenderness, so there is no DVT, no cellulitis, anything not there. And lastly, rarely we can find out the sun any like snake bite anything or lymphatic spread or lymphatic blockage, and we have found the lymphatic cause also. There is no any lymphatic blockage in this patient, so there is no any bite also, any bite marks, any insect or snake bite, anything is not there. So only thing we have to do clinically, even if is clinically is absent, we have to go for the echo and ECG and the chest X-ray. Chest X-ray to go for the rule out the cardiomegaly, and the ECG to rule out any other cardiac conditions, and echo also to rule out any low ejection factor that causes an overload, fluid overload condition. And one more thing is bilateral arterial or venous Doppler to look for any arterial disorders or any blockage in the arteries. Thank you. And next video we will discuss the same.